Hello, my name is Dr. Sing Huang, Senior Medical Oncologist from OncoCare Cancer Centre. In this video, I will be sharing with you some information on understanding breast cancer. In Singapore, invasive breast cancer has been consistently ranked as the leading cancer among females over the past 50 years. Fortunately, more than 70% of invasive breast cancers are diagnosed in their early stages, namely stage 1 and 2. The risk of developing invasive breast cancers increases sharply from 30 years of age onwards. It peaks among females aged 60 to 79 years, before gradually declining after the age of 80. The survival of breast cancer depends on the stage at which it is picked up, with higher survival rates the earlier you diagnose it. Although your use of mammography is increasing, a significant proportion of all breast cancers are still diagnosed as a result of symptoms, most often a painless mass. However, some present itself with breast pain and no lumps. Less common symptoms include nipple discharge, nipple erosion or ulceration, diffuse redness of the skin of the breast, enlarged lymph nodes in the armpit area, and less commonly symptoms associated with involvement of other organs due to spread of the cancer. It is good to cultivate a habit of examining your own breasts, as it will enhance familiarity with what is normal and enable you to pick up things that feel unusual more easily. If you notice anything different in your breasts, you should seek medical attention as soon as possible. Often, a mammogram and ultrasound will be done. The mammogram is a simple, low-dose X-ray examination. Tomosynthesis, or 3D mammography, is a new type of digital X-ray mammography which creates 2D and 3D-like pictures of the breast. This tool improves the ability of mammography to detect early breast cancers and decreases the number of women called back for additional tests for findings that are not serious. Targeted ultrasound is commonly performed for an abnormality detected on mammogram. An MRI of the breast is used sometimes as an aid to a mammogram to better assess the extent of the breast cancer. It's also used to screen for breast cancers in women thought to have a high risk of the disease. Once a suspicious abnormality is detected, a core biopsy is then done to obtain small pieces of tissue to make a diagnosis. The risk factors you cannot change are your gender, age, race, your family history of having relatives with breast cancer or other related cancers, your genetics, the density of your breast, your personal history of any previous breast conditions, which may put you at a higher risk, and the age at which you had your first period or became menopausal. Other hormonal factors that may increase the risk include factors like never having had children, or having your first child at a later age, not breastfeeding, or prolonged hormone replacement therapy. There is consistent evidence that breast cancer risk is higher for women consuming alcohol compared to abstainers. Regular physical exercise appears to provide modest protection against breast cancer, particularly in postmenopausal women. The reduction in breast cancer risk seen with exercise is likely mediated not only through weight control alone. Treatment aims and outcomes are dependent on factors like stage and subtype. For cancers confined to the breast and regional lymph nodes, i.e. stages 1 to 3, we treat with curative intent. But for stage 4, meaning advanced disease, treatment is aimed at controlling the disease and prolonging survival. Breast cancer is broadly subdivided into 3 kinds based on its biomarkers, namely the estrogen receptor, also known as ER, the progesterone receptor, also known as PR, and HER2. This subdivides breast cancer into 3 main groups. Firstly, the hormone receptor positive subtype, which is the most common. Following that, the triple negative subtype, and finally, the HER2 positive subtype. Surgery is an indispensable part of the treatment for stages 1 to 3 cancers. Chemotherapy, radiotherapy, and anti-hormonal therapy for hormone receptor positive cancers may be needed as well, and these are given with curative intent. Sometimes chemotherapy has to be given to shrink the tumor before surgery to facilitate the chances of preserving the breast or converting an inoperable cancer to one that is operable. If the tumor is HER2 positive, anti-HER2 targeted therapy may be utilized too. Stage 4 cancers may require a variety of treatments such as chemotherapy, anti-hormonal therapy, immunotherapy, or targeted therapy, depending on the type of cancer. Breast cancer survivorship essentially is a journey which starts at the time of diagnosis because most women with early stage disease will be cured of their cancer and will not have recurrences. Even those with more advanced disease can survive for years as a result of improved therapeutic options. Everyone copes with the diagnosis of breast cancer in different ways and are likely to experience a range of emotions. Dealing with the psychological impact of breast cancer is also an integral part of our management. Lifestyle modifications can be an empowering and effective way to boost physical and mental health in breast cancer survivors, and possibly to improve disease outcomes. This includes embarking on healthy eating diets, regular exercise, minimizing alcohol intake, and stress reduction to improve the overall quality of life. We are fortunate in this present time where research has resulted in a greater number of improved therapeutic choices than we had a decade ago. As such, the diagnosis of breast cancer is to be faced with courage and hope. In reality, many women are cured from their cancer and go on to lead happy and fulfilling lives. I hope this video has enabled you to gain an understanding on breast cancer and will help you in your journey through treatment and recovery.